just been diagnosed with multiple sclerosis, or maybe you're trying to get a diagnosis, you're dealing with different neurological symptoms and you're not sure what you have. Maybe the neurologist has recommended that you should have an MRI. We're going to talk about how and why MRIs are used in the diagnosis of multiple sclerosis, but also we're going to talk about how accurate they are and how safe they are. So if we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And it is a real privilege for me to share this information with you because I'm going to be giving you an angle on the MRIs that you're not going to get from your neurologist. And this is really, really important early on in your diagnosis because how you decide to move forward with treating the disease that you're dealing with or the symptoms you're dealing with is really going to determine the quality of life that you have for the rest of your life. Hello, Margaret. Hi, Maurice. You guys can hear me? Awesome. So right now, MRIs are very, very popular in diagnosing multiple sclerosis. And the MRIs are, I'm just going to go over to my notes here because there's a few things that I wanted to share as far as the specifics or the details of it. But MRIs are magnetic resonance imaging, and it's a type of, it's like taking a picture of different organs, but with multiple sclerosis, it's going to be taking pictures of your brain and your spinal cord because they're looking for lesions. The experts are looking for lesions to see if you have lesions present there. And the MRI uses basically what it's measuring, it's taking a really strong magnets in the MRI, the machine itself. So it's creating this strong magnetic field and also radio waves, and it's measuring the relative amount of water in tissue. So in a healthy nerve or in the healthy brain where we have a lot of the myelin sheath, which is a fatty substance around the different nerves, in those areas, there's going to be a little less water. But what will happen is with multiple sclerosis, when there's damage to the myelin sheath or it's stripped away from the nerve, more water will go into that area. And so it's going to show up on the MRI as a white spot or a darker spot, depending on what type of scan that they're doing. So that's what they're really picking up is basically changes in the amount of water in certain areas. And with multiple sclerosis, we're definitely looking in the central nervous system. So that myelin sheath is what becomes inflamed. And this allows our neurologists to have some detailed pictures of areas that are where there's lesions in our brain and in our spinal column very often. So you might be wondering what a lesion is. They don't know what really causes lesions. They believe that our immune system is attacking our nervous tissue and causing the lesions, when in fact, we're going to talk about really what we believe it is, and it makes a lot more sense later on. But a lesion is basically a damaged area, and it'll show up on these MRI images as like a white spot, a bright spot, or a darker spot. There's different types of scannings that they do. So it's basically damaged nerve tissue. And it's interesting that these lesions can be found in different parts of the brain, in the white matter and in the gray matter, especially around the ventricles. So right in the very center of the brain, there's ventricles, they have a lot of spinal fluid in them. And so the lesions it's very common that they are around the ventricles, both on the left and right hand side of our brain. But we can find these lesions also in the brain stem and the cerebellum, and also the spinal cord and the optic nerve. So for myself, when I was first diagnosed with MS, I had optic neuritis, so my optic nerve was inflamed. And these lesions are present, as I mentioned, in both the gray and the white matter of the brain. And they find that for people that suffer with progressive multiple sclerosis, they would tend to have more gray matter lesions. So those are just different parts of the brain. But what's so fascinating when I was doing research on this is that the MS, these lesions, they are most often, I don't know if they're always, but very, very often when they're looking at the MRI scans, they see that these lesions are always, they form around venules, so small blood vessels. So our arteries, go to smaller vessels and then goes to capillaries, and that's where there's an exchange of nutrients and oxygen, etc. And then they go to a little bit bigger vessels, which are the venules, and then to the veins. So that would carry the blood that is not oxygenated, the venules. So it's interesting how these lesions are present. And when you think about infection, which we're going to be talking about later, it really makes a lot of sense that that would be located, because that's how they're getting into the central nervous system, is through our blood system. So what is helpful, I think, is that with these lesions, what they have discovered is that when they're located in a certain spot of the brain or the spinal fluid, spinal column, then we would have certain symptoms. So for example, maybe you're dealing with dizziness, or so impaired balance or coordination, then they have found that more often there will be lesions in the cerebellum, which is in the lower back of the brain. Or optic nerve. So some of you might have had an optic neuritis like I did. I had really severe optic neuritis. That was my very first symptom. And it was a complete blackout on my left eye for at least 6 weeks. And then also the spinal cord. If we have lesions along our spinal cord, the researchers say that this is often what sends us to the doctor, because we have symptoms like muscle stiffness, numbness, tingling, pain in legs and arms, or both, and problems with passing urine. So we have bladder issues, and also we can have bowel movement issues. So we do know that the infections, the parasites in the intestines, they definitely cause a lot of problems with constipation, but they feel that it also impacts our bowel movements if a certain part of our spinal cord is impacted with these lesions. So I find that is probably somewhat helpful, because then you can kind of understand, it's like, okay, well, I'm dealing with balance issues. So it's maybe the cerebellum, the bottom back part of my brain, maybe that's where the infection is sitting, right? Or I have these and the problem is too, we can have multiple lesions. So we could have lesions in different parts of the brain and in the spinal cord also. So the MRI will show, these images will show the neurologist both past inflammation and present inflammation. So the lesions that are active now and maybe were active a long time ago, and also brain atrophy, where basically our brain is shrinking. And they do see that in multiple sclerosis. This is very, very important, what I'm going to share right now. So knowing the number and the size of these lesions in the brain and spinal cord, that does not reliably predict the clinical outcome for the MS patient. So that's a really big problem. So it's great that they've identified lesions, right? They don't know what's really causing them. We do, but they don't know yet, which we're not even going to go there right now. But the problem is that if you're doing something to diagnose MS and you're using it to monitor, we'll talk more about that, like which medications to give, if it doesn't line up with what lesions they find and how the disease is going to progress, it's not very helpful. So that is really important. So there's a really prestigious neurologist at the Cleveland Clinic shared that MRIs are quite poor at predicting an individual basis, on an individual basis, the clinical status of a patient. So he's basically saying that MRIs are really poor at predicting a certain individual's clinical status. So that's the problem, is that, and we'll talk more about what they're seeing and why they're saying that. So many lesions can appear on an MRI image, and the patient isn't having any more MS symptoms, but you go in and you have an MRI done, and there's all of these white spots lit up in your brain and your spinal column, and you don't have any more symptoms than you had when you went in last time. And so they'll say the disease is that much more active, but you're not having symptoms of disability. But then those lesions can just disappear again. So they can come, they can go, they can stay. And so this is really, really unpredictable. It's not very helpful, because we're not just interested in do we have lesions or not, and what drugs are we going to take? We're interested in what is causing these lesions, and is there some way that we can treat these lesions, and that we can get our health and our life back, and we don't have to rely on medications for the rest of our life. So in our students, we've had over 700 students take the Live Disease Free Academy, which is a 3-month online course where I help them learn how to play an active role in their health care and do a lot of the work themselves to get ready to treat, to find the right practitioners to access the treatments. And we'll talk more about what they're treating, but it's basically parasites, and they're recovering. But when people come to me, very often students, or a person that's a brand new student, maybe they don't have a diagnosis yet. And sometimes it takes 6 months to get a diagnosis, and you go for multiple MRIs. I was going to say, you guys go ahead and stick your questions in the question box, and I'll answer a few of them after, but we will definitely answer them even on if you're just listening to the replay. So with a brand new student that comes to me, maybe they're in the process of being diagnosed, but they hear the message that we do know what causes MS, it's caused by infections. They decide, I want to go that route. They might have had an MRI, and they may have no lesions that are present, or not the typical MS lesions. And they might have 7 symptoms of multiple sclerosis. So that could be one person. And then another person that's been through my program has had a clinical diagnosis of MS for many years, 5 to 10 years, quite disabled, lots of lesions. In 3 months, they can become close to symptom-free, and they're able to come off their medication, working with their doctors, and a year later, still being symptom-free and still off their meds, but they still have some lesions. So that's the problem, is that how valuable is this really in diagnosing and in helping us to determine the proper care for MS and the long-term care for multiple sclerosis. So it's really important to talk about these things, very important. So that's what we're seeing in our students. Again, knowing the number of lesions and the size of lesions is not a reliable predictor of how a person is going to do, how quickly they become disabled, how slowly they become disabled. So that is not really the predictor. What I believe is the environment, is that these lesions are pockets of infection, and it depends on what we eat, how well we feed those infections, do we sleep, how strong our immune system is, the stress level, the medications we're taking, all those factors, that is a little aside. So the discrepancy between the number and size of lesions in a patient and the patient outcome is called clinico-radiological paradox. So you can look that up, and you can look at for yourself. There is a study, I'm sure there's more than one study, but basically in the scientific world of MS, they have this big fancy name, clinico-radiological paradox, basically meaning that what they're seeing, the clinical observations, and when we are diagnosed with MS, a lot of times we have the MRI, we have the clinical observations, they do some muscle testing, other tests, sometimes a lumbar puncture. I'm going to talk about that next week. But there is such a discrepancy between what they're seeing in how a person is progressing versus the radiological, what they're seeing on the MRI. And so they call it a paradox because it's not congruent. It's not consistent. So it's a really big deal. It's a really big concern. And what happens is people get misdiagnosed, whether they don't get an MS diagnosis or whether they do and they shouldn't have had an MS diagnosis. So another huge problem is that lesions are present in other conditions, and also they're present in our central nervous system as we age. So when we're over 50, like myself, very often people will have lesions in their central nervous system. So if people have a condition like Crohn's disease or autism, maybe even migraine headaches, they will have lesions in their central nervous system. And also people over the age of 50 will very often have lesions in their central nervous system. They don't have MS, they don't have symptoms of MS, but they have lesions present. So it's really difficult for neurologists because they have all of this issue with the MRIs, and then they're also using an EDSS survey tool or a clinical measurement tool, which also is difficult. It's not very sensitive. So MRI images used in the diagnosis. I guess what's really important, what I wanted to share right now, is that what they're using the MRI images for. So when we go in and we have either we're diagnosed or else we have a follow-up MRI, maybe they put us on a treatment and they're following up. What they're using the MRI to do is to monitor how well we're doing with treatments based on lesions, not based on how we're feeling. So if we take a certain disease-modifying drug, an MS disease-modifying drug, and they find that there's less lesions, they think that's good. You have less lesions. We are changing the outcome of the disease. But we can still feel awful. We can still have the symptoms. We can still feel terrible. And a lot of people that I've talked to, over several thousand people by now, they feel, and these are people that don't work with me even, they feel that they feel better going off of their MS drugs than when they're on. And I'm not saying you should go off MS drugs. I'm just saying that's what I hear from people. Because the disease-modifying drugs, I'm sure if you're on one, you've researched it, they have very strong adverse effects. And really what the bottom line is, because I'm not against medications. We use medications to treat the infections that cause MS. But the disease-modifying drugs for MS, they're all suppressing the immune system. So we have inflammation. That's what's in the central nervous system. That's what the lesions are. They're damaged tissue from inflammation. And if you watch any of my work, you know that inflammation in chronic disease is caused by infection. So that inflammation is caused by infection. So our immune system is fighting that infection. And so that's the war zone, right? The war zone is the inflammation, is the war caused by our immune system fighting the infection. So the disease-modifying drugs will suppress the immune system. Then we'll have less war, we'll have less inflammation, but the infections are still there and we still feel awful. We still become more and more disabled. So that's the problem with where we're at with the MRI. And so we're using the MRI images to monitor the activity of and the number and activity of the lesions, which in fact doesn't line up with how people progress to disability with multiple sclerosis. That is a really big deal, because really, who cares if you have a lesion in your central nervous system if you have no symptoms? You just want to be able to walk and run and work and play with your grandkids. That's what's really important. So again, very important to understand the disease-modifying drugs. They suppress our immune system. And so there's less war, there's less inflammation. We may see an improvement in lesions, but we still have those infections and we still feel horrible. That's why they're not the answer. And that is why the MRI is not really helping us in the way that it's being used right now. All right, so summary. This is really important to go over a few things to just summarize everything that I've shared with you. So MRIs, they can help us to see patterns of where lesions are. Lesions are pockets of inflammation. And so we can kind of see where there are lesions. Lesions shouldn't be in our central nervous system, for sure. I believe they're pockets of infection. And so it helps us to see where they are. And that really helps us to understand what kind of neurological symptoms we will experience, as I mentioned before, whether it's balance issues, whether maybe it's in our spinal cord and we have different symptoms. So that's fine. That is helpful and that is not an issue. But the problem is that it's not helping us to really change the outcome of the disease. So this, in summary, the disease-modifying drugs, they will suppress the immune system. The patient has less lesions, but little to no symptom improvements. And we talked about that. Okay, so number one. So I want to take a few steps right now to use common sense and some simple facts. Number one, our immune system defends us from infection. True? Yes, absolutely true. Number 2, inflammation is present in MS, in the lesions in the central nervous system. So that is a fact. So we have lesions, they're caused by inflammation, there's tissue damage, so that is a fact. Number 3, infections cause inflammation. That is true. We know that if you get any type of an infection, you know that it will cause inflammation, because inflammation is the war of your immune system fighting the infection. So those are 3 facts. Number 1, that our immune system protects us from infection. Number 2, inflammation is present in the central nervous system of people that suffer with MS. That's what the lesions are. Number 3, infections in the body cause inflammation. Number 4, the central nervous system is not a sterile environment. Microbes are present in the central nervous system. They can get in there. Our blood-brain barrier can be compromised at times, and microbes can get in through many ways that we probably don't even know. But it's been proven that our central nervous system is not sterile. There are studies right on our website, livediseasefree.com, where they found candida in the central nervous system of MS patients, even in the brain cells, in the nucleus of the brain cells. There's Borrelia, which is Lyme disease. There's many different ones, and Dr. Alan McDonald has found filarial worms, and I've done videos on all of these. Make sure to watch them. I've got a playlist on YouTube, Live Disease Free, if you want to learn more about the infections. So we know that there are filarial worms he found in 10 out of 10 patients that he tested the spinal fluid. He found immature tapeworm, so juvenile tapeworms, in 2 out of the 10. There may have been more, because he might just not have seen it because he just took a small amount of spinal fluid. So maybe it wasn't in that small amount of spinal fluid that he found, but they were there. So tapeworms, filarial worms, candida, bacteria like Lyme, and I'm sure many, many other different types of infections. So we know that the central nervous system is not a sterile environment, and our immune system has to be in our central nervous system to protect us from the bad microbes, the disease-causing microbes that would get into our central nervous system. That's another problem I have with the disease-modifying drugs, is that some of them, and what I want you to do is just to start learning. If you're on a disease-modifying drug, I'm not saying stop it. Learn the disease, how it works. It's called the mode of action. Some of them are blocking our T cells and our B cells, keeping them out of our central nervous system. So that makes us more susceptible to out-of-control infections in our central nervous system. So I have a problem with that. And then I already shared with you that different infections like candida and Lyme and filarial worms and tapeworms have been shown to be present in the central nervous system, the spinal fluid of patients and brain of patients that have MS. And then I've done videos where I've shared how when parasites are, like studies where people are really sick and they have neurological symptoms similar to MS, and I'm not sure why they would have done that, but they looked and they have found that they had lesions, and they looked at the lesions, and lesions were caused by parasites. So this is in animal studies and human studies, that when parasites get in the central nervous system, they cause lesions. It's in the literature. You can read it yourself. So when we have our immune system fighting something in our central nervous system, we know that these microbes can get into the central nervous system. It's been shown in many studies that some of these infectious microbes, parasites, are present in the central nervous system of MS patients. And we know that parasites can cause lesions in the central nervous system. Could it be that multiple sclerosis is an infectious disease? Absolutely. And so if it is an infectious disease, then why don't we, instead of just monitoring and just suppressing the immune system and trying to keep the lesions down, why don't we go for the cause, and why don't we treat the parasites? Why don't we spend a lot of research into what kind of infections are causing multiple sclerosis? That's really the answer, and that is what the Wellness Champions do in the Live Disease Free Academy. We have many people that have recovered, and that's how I've been able to live over 30 years now free of multiple sclerosis, is through treating these infections. Really, really important. If this is all new to you, I really recommend watch my videos. I have a playlist of infections that cause MS, and just pick and choose what you need to learn, and then try the eating plan. Start to decrease the carbs in your diet, and you'll start to feel a lot better because those microbes thrive on carbohydrates, and you'll start to say, oh my gosh, this is working. I feel way better. And if you are in the process of getting diagnosed or you've just been diagnosed, I can tell you that if you treat the disease right away, you recover that much quicker and you can just get on with your life. And I just really hope that we can catch people right away when they just get the diagnosis, treat the parasites. We often have students that if they're catching it early, within, like, they're highly functioning, or maybe they've just been diagnosed or they've had it for a year or two, but they're still doing really well. When they treat these infections, they just get back on with their life, but they can become symptom-free within as little as 3 months. They still treat a little longer, but they become symptom-free that early. So I'm going to go to your questions. I'll answer a couple of questions now. Hello, Maurice, and hi, Margaret. Hi, Dawn. The MRI readings, they are confusing, and they are confusing for the neurologists also, Margaret. That is why they often will want to do a lumbar puncture, or they'll do another MRI, and it is difficult because a lot of people with other conditions have these lesions also. Maybe not exactly in the same, but it's like splitting hairs, right? And that's the problem. Jessica, that's how you were diagnosed with the MRI. That's pretty standard nowadays. Hi, Valerie, Bonnie. You didn't see your results, and that's one thing that when I was listening to some different neurologists, they said, you have a right to see. Not that you'll totally understand, but what I would do is just maybe go through my video again if you are going to have an MRI or if you've had one done. But just go through it again and just ask some questions. But you should see your MRI. And before I forget, I just wanted to mention that there is an MRI with contrast, and it's a specific dye that they would use, and it helps apparently to show lesions that are more active. So the problem is that you have to understand that that dye doesn't come without risk. I want you to research that to see if you truly want to use it or not. The benefit of having an MRI is so that they will know which drug to give you. So they will call it relapsing remitting, or they'll call it progressive. And then they will also use the MRI to monitor your progress of lesions when they're using different drugs. And obviously, if your blood work showed that you were really dangerously low, your lymphocytes, they would change the drug too. But they do use the MRI, the presence or absence, or the how active the lesions are. They use that a lot in determining what kind of medications they're going to give you. And honestly, though, a lot of people tell me that when they get the diagnosis, they're given a list. It's like, here's the list, you pick one, and the patient has to pick a drug, which is insane. This whole thing is insane. So the key is that with having an MRI, if you have one done, if you don't have to do the phase contrast, then don't do it, or just read up on it. I never tell people what to do. I encourage you to research this yourself and make a decision if you feel the risk is worth the benefit. That's always risk versus benefit. Because with an MRI, there is no cure for MS. It's really just if you feel the medications are the best option for you, that is what you would do. But I mean, it is nice with our students that, as they become symptom-free, they often still have lesions, but then in time, very often the lesions will heal over. And that just means that they're doing a really good job of treating the infections all the way down into the central nervous system. But that's really the only benefit, because if you're not going to take the MS drugs because you've researched them yourself and you've made the decision that the adverse effects are just too dangerous, that then, you have to make that decision. But with contrast, please look it up, because that dye does come with definite risks. And it is a very strong magnet. You're right, Valerie. The MRI is a very strong magnet. So even the MRI itself, the test, is not without a negative impact to your body. And the problem is it's not super helpful. That is the biggest problem. So then you have to really decide, is the benefit more than the risks? So Jamel is asking, how many lesions did I have? Well, I'm very fortunate that I did not have an MRI. I was diagnosed in 1988, and I was diagnosed at a university MS hospital clinic, and then had another neurologist follow up with me. But because I had such severe optic neuritis for weeks, like complete blackout, weakness and tingling in my legs, and I did have other symptoms like early on, like fatigue, etc., like a lot of that. But luckily, early on, I learned about infections, and I made a whole shift towards this way, and so I was able to totally reverse it. So he said, I'm not going to put you through a spinal tap. That's what he would have done, but he said, I'm not going to do it. It's very painful. And he said, I'm totally confident that you have MS. And I had such optic neuritis, terrible, that I actually have damage in my left eye. I could not drive right now with my left eye, the vision. You can't tell, but basically it's like a dark room. So most people recover from optic neuritis, but mine was really, really severe. I don't know, Jamel. I'm over 50. I'm like 60, or I'll turn 60 this year. So I could have lesions. I'm like, with what I know, I should back up. Because I had multiple sclerosis, that means I was infested with parasites. And I've done a really good job at knocking them back far enough so I could be MS free. And I live what I teach. If I was eating beer and pizza all the time, I wouldn't be feeling like this. So I've managed to keep them down. But it's pretty impossible to live in this world without having these critters, impacting your health and your life, especially if you used antibiotics in the past and just the wrong diet younger, and just living on planet Earth. We're exposed to parasites all the time. And so we just don't recognize them or treat them. And when some of us are exposed and we have been on too many antibiotics, and then we eat too much sugar to feed the problem, and maybe we have a very, very busy life and we don't take care of ourselves, etc., then these parasites get the upper hand on us. And depending where they live in the body, that gives us specific symptoms and specific disease labels. So when they're in their central nervous system, we deal with multiple sclerosis. But again, that's not the whole answer. I don't have the whole answer. There are people that have lesions that are over 50 that don't have neurological symptoms, autism, people that suffer with autism, migraines, Crohn's disease. Again, all of those people show lesions in their central nervous system, and all of those people have infections. The thing is that it's just the lesions are caused by infections. And I could have a lesion or two, I don't know, but I feel pretty darn good. So it's all about learning how to manage your microbes well enough so you keep the population of the bad ones low enough and the population of the good ones high enough that you have a wonderful life, that you live many years into retirement. By the time we get old, the people that are in the extended care facilities that are really disabled, they are so infested with these microbes, the bad parasites. And that's really what's making them so disabled and so cognitively impaired, dementia, etc. It is infections. And so we just have to try to manage them better. And that's a skill we've never learned. And that's what I teach people in the Live Disease Free Academy. So you weren't told how many lesions or where. So Bonnie, you can just ask if you are going back, if you ever have an MRI, you should be able to get a copy, and they should be able to tell you. They should give you some basic, they don't have to get deep into the science, but they should be able to tell you. So last MRI is showing more lesions, and lesions disappeared, doctor pushing meds, which you never have taken. The problem is that from what you've seen, what I've shared, and we're going to do a blog post so you'll be able to have all the references too, and you can just do your own research. Unfortunately, the MS drugs don't work because they're not treating the cause. You don't know what lesions went away. No, lesions can go away, Susan. Absolutely, they can. Thanks, Margaret, for your kind words. Hi, Daryl. So does the contrast dye affect us long-term? I don't know. I haven't had enough time to go deeper into that. I do know that we're supposed to have a really good, healthy blood-brain barrier. But when we have inflammation in our central nervous system, and that could be part of our immune system just kind of getting more soldiers in and getting more of the defense in, etc. But our blood-brain barrier becomes compromised, and then that dye gets into the blood-brain barrier, gets through it, and gets up to the area that is where the lesions are, where the infection is. So how long it stays there, but there are some different diseases or conditions you can get from it. So that's why I said, please look into it. It's pretty easy to find that information. Yes, the lesions disappear, Margaret. Way to go. Hi, Patricia. Susan. Okay, I'm just looking for questions. I think it's a lot of comments. So Bonnie, you have a friend that had a second MRI after 20 years, and she was told that she doesn't have MS anymore. So I don't know. I don't know if, does she still have symptoms? I don't know does she have symptoms? But there are things like if let's say you just come down with MS, there could be the very odd person that, we've got a parasitic infestation, it's getting into the central nervous system, but maybe things change in their life well enough that less stress, stronger immune system, different choices, cleaner environment, where their immune system now will deal with those infections and heal, because those lesions come and go. That's what they say with the MRIs. So then maybe this person was very fortunate that their immune system was able to deal with the infections. Yeah, maybe no MS in the first place. Definitely, a lot of people are misdiagnosed with the MRIs. We're going to talk more about that next week. So next week, I'm going to talk about, there's a lot more comments here. I'm just going to go through them after, and my team will help answer the questions too. But next week, I'm going to talk about lumbar puncture, because sometimes that clinico-radiological paradox with MRIs is so confusing that they want to do a lumbar puncture to make sure that they get a proper MS diagnosis. And again, with the lumbar puncture, it's so fascinating because it really points to infections again. I just don't, it's like common sense. It's like, can we get back to common sense? So if you're at the place where you've just met me and you enjoy listening to these trainings, make sure to like and please share this with other people and subscribe to our YouTube channel, Live Disease Free. If you're at the place, and watch my videos, watch the eating plan, watch the infection playlist, the eating plan playlist, start to implement, start to feel better, start to believe it in your heart that there is a better way for you to recover from MS and get your life back. But if you're at that place where you're like, Pam, I've done that and I believe it and I'm ready and I need a plan and I need support, then reach out and watch my masterclass training. And in that, you'll be able to go a lot deeper into understanding how these infections cause MS, a lot of wonderful wellness champion stories. And then you can talk to me. You can book a time to get all your questions answered about the Academy. You can get started right away. We've had a large number of students just in the last 2 or 3 weeks joining us. So we've got a fresh new group of students starting. And you'll be hearing a lot more of their successes as we go. So next week, we're going to talk about the lumbar puncture or the spinal tap in diagnosing multiple sclerosis. Oh, I forgot to mention, please, we're doing the Live Disease Free Eating Challenge. So if you haven't joined us yet, it's really super fun. If you don't know what the Live Disease Free Eating Challenge is, watch some of my videos on the playlist on Live Disease Free YouTube. Learn it. It's just low carb, super healthy. Start implementing. Share the pictures of your meals, what you're eating. And for each picture that you share, then I'd like you to you can post on Facebook and YouTube. Make sure to tag us. I don't know if I have the information here in front of me. That's too bad. But you have to tag Live Disease Free Challenge. Otherwise, we can't find your pictures. But you'll have one picture is good for 2 entries if you'd put it on Facebook and Instagram. And then in March, we are going to do 3 draws, and it'll be a coaching session with me and a $100 Amazon gift card. So this really is fun because it's getting people ideas on what they can eat, because we don't like boredom, right, with what we're eating. So make sure to share your pictures of your Live Disease Free eating compliant, the plate, just what you're eating. Doesn't have to be recipes, etc. You can describe what you're eating. That's kind of fun. So please make sure to do that, Facebook and Instagram. Live disease free, and tag it. Otherwise, we can't find your pictures and we can't put you in the draw. So it's Live Disease Free Challenge, Live Disease Free, tagging it on Instagram and Facebook. And one picture will be 2 draws if you put it in both places. So with that, I will talk to you next week. Take care and bye-bye for now.